Okay, so it's great to be back. Today I've been asked to talk about the dental marketing mistakes. So what I'm going to talk about is what we have seen with our experience of working with practices in Australia and New Zealand. There are a number of mistakes that we see practices make very, very often. And so I've picked the top 7 to talk about today, so hopefully you'll be able to have a good understanding when you leave today, and hopefully you guys here won't be making mistakes, falling into the pits that many of the practices do. You know, the real reason I'm here today is the change, and the change that we're seeing in the dental industry, changes we're seeing in marketing, on how you can market a business, how you can market a practice. So it's almost like it's a perfect storm for you guys. You know, once upon a time, this could be how you could market a dental practice. But nowadays, it looks a little bit more like this. You know, there are so many things that you could and should be doing to market your practice. There's so many ways that people are thinking they should do. They might be trying, people might be giving you advice, and it is just completely overwhelming and very, very complex. So the challenges that we're seeing in the dental industry is, you know, there is increased competition. Now, practices are popping up all around the place, and if that's not bad enough, then practices, or you can go and get your dentistry work overseas. I was on a course recently and a guy came up to me and he said, "Hey, look at my smile," and I'm like, "Yep." He said, "Veneers, I've just come back from Phuket." That's like, okay, and this is, you know, CEO of a company, he is not short of a penny and he's gone to Phuket. So, you know, it's happening to everybody, everywhere. There's the corporate, there's the insurance providers. There is an oversupply of dentists. You know, your operating costs are ever rising. Your patients are much more marketing savvy. So what they expect from a business when it comes to marketing is getting higher and higher and higher. You know, potential patients are more discerning. They're looking around, they're shopping around. And as I said, overseas dentistry. So there are many things that are affecting you guys when it comes to running your practice. You know, the marketing challenges that I see, and I'm guessing that you also see them as well, is that you guys are probably being called all the time by marketing companies, SEO companies, Google AdWords companies. Yeah, all the time. I'm guessing that you have people that care about you, care about the practices you're in, who are giving you great advice. Patients, team members, members of your family saying, "You should try this, you should do that. Oh, I saw a practice over here that did this, it was really great. Saw a restaurant that did this, you should try that." True, everybody's got an opinion. And the reality is constant evolving marketing. So social media, what you can do one day, you know, the next day or the next week, there's something new. There's another bright, shiny object for you to look at and think about. And I'm guessing that you guys just want to focus on delivering great clinical skills to your patients. So the 3 main problems that we see when working with dental practices is there is no plan. You know, you think, I must do some marketing, but actually what am I going to do this year or this month? No overall plan. Wrong skills. Most people have no formal training in business, have no formal training in marketing. So really, how are you supposed to get your head around this and make sure you're doing the right things for your practice? And the third one are the practices that have been burnt. The sharks and the cowboys in my industry, the guys that are phoning up and saying, "You need AdWords, you need SEO." There are many, many practices, and I speak to them on a, unfortunately, daily and weekly basis, where they have been sold something that they don't need, that's not working for them. So the 7 mistakes, and this is what I'm going to cover today, and hopefully you'll be able to leave here today with some thoughts, some ideas of how you can stop this happening in your practice. So number 1 is not knowing your numbers, not knowing the numbers behind your marketing. Number 2, your ideal patient, who you're actually trying to market to. 3, silver bullet, thinking that there's one thing that you should do to your marketing that will solve all your concerns. 4, scattergun approach, trying a little piece of everything. 5, thinking that you can do it all by yourself and it's going to be okay. 6, procrastination, not doing anything. Number 7, not getting the right advice, not listening to the right advice. So in today's presentation, I want to explain what the mistakes are. I want to explain what you can do to avoid them and how you can stop making these mistakes in the future. So you can relax a little bit. I can send you copies of the slides. So there's a form in front of you. So if you do want a copy of the slides, please just fill that in and give it to me at the end. And also there's an ebook. So there's an ebook that I've produced along with this presentation that again I can send to you. There's a copy over there for you to look at that's got some words around the presentation and all of these points. So who am I and why am I here? I'm here because I am passionate about educating the dental industry. I am honestly sick and tired of talking to practices that have been sold something by the sharks and the cowboys of the dental marketing industry, or the marketing industry. I need you guys to understand what you're doing in your practice, what you should be doing to market your practice, what you shouldn't be doing. I need you guys to take back control. As you can tell, I don't have an American accent. So many people think, oh, it's dental marketing, it must be somebody from the US. No, okay? Even though I have an English accent, I've been here for 18 years now, hence the strong Australian accent. So everything I talk about is based on the Australian market, what I've learned in the dental industry in Australia. Because, the reality is, what happens in the US and what might work in the US doesn't work here. The Australian market is different. Needs to be tailored. So 20 years or over 20 years in marketing and sales, and over 10 in health and medical marketing. You can have a look at what 18 months of my life looks like over there in the corner. I have basically put everything that I know, everything that I think you guys need to understand in a book, because obviously I cannot talk to every practice in Australia, and I'm hoping that I can get the word out to make sure that you guys are educated enough, so when you talk to suppliers, when you talk to your team, you've got something there to check back. So there's checklists, there's case studies, it's in a format hopefully, so if you're looking for a specific thing, you can just go into the book, read that section and have some knowledge so you can ask the right questions. So My Dental Marketing, who are we? Established in 2009, we just had our 8th birthday. We were Wellsites, Health, Medical and Dental Marketing, and we rebranded in 2015 to reflect our market. So 75% of business is dental marketing and 25% is historical. We get medical practices just from our past. There's 13 of us in Australia. Everything is done in Australia. Everybody you talk to is in Australia, and we've worked with over 400 practices. This is some of us. You can see there's a slight gender bias, but our photographer is male. Okay, so all Australian based. Okay, and what do we believe? We believe that every practice is different. Every practice has a unique patient base, has a unique area, has unique wants, has unique passions. And as such, every practice's marketing should reflect what makes them different, and I will talk more about that later. So now you know a little bit about me, I'd like to know a little bit about you. So who here is a practice owner? Okay, great. Practice managers? Great. Team members? Fantastic. Okay. So who here is here on your, who here has come as a team? With somebody else from your practice? Okay, great. Who here is responsible for the marketing of your practice? Okay. This is always a good question, isn't it? Because people kind of go, oh, I'm not sure. Who here thinks they probably should be responsible for their marketing? Okay, and how do you feel about your marketing of your practice? Let's be honest here. Who is really happy? Everything's going brilliantly. Fantastic, well done. Who here is going, yes, it's all right. Yeah, we could probably change a few things, but okay. Who here thinks, probably not too far off, but more no's than yeses. Who here, train crash, no idea? Okay, who here has no idea? Okay, thank you. Hopefully at the end of this you will have more of an idea and things will be a little bit clearer. Okay, so a few ground rules. Phones to silent, please, but if you do want to take photos of any of the slides, please feel free. Share with your friends, all fine. Questions? There are the 7 sections, so if you could hold your questions to the end of the section, that would be great, because I'm sure whatever you're thinking, somebody else will be asking or thinking the same thing. We have a break halfway through, so I'll be able to take questions then, and I can stay behind at the end. So hopefully nobody leaves without their questions answered. If you do leave without your questions answered, again, tick the box and we can arrange a time to talk.